My topic is pathogenesis and diagnostic of growth hormone deficiency in adults. My name is Ana Belén Añasco Lima. Definition: growth hormone deficiency or disorder of the endocrine system is occurs when the body does not produce enough growth hormone, aka syntropic, due to uses in the glands on the anterior pituitary. Application in medicine. DAD is termed to be present for birth diagnostic usually only occur when the patient's short stature becomes noticeable around 5 years of age or during the beginning of puberty. In adult onset, the diagnosis usually comes with a discovery of pituitary tumor.
Lifestyle medicine is the use of lifestyle interventions directed at the treatment, management, and prevention of disease.
Hey folks, Dr. Keel here, and I want to take a few minutes to talk to you about growth hormone. This peptide hormone, also known as somatotropin human growth hormone or HGH, is a physiologically active hormone that has a significant role in multiple processes in the human body. Growth hormone synthesis, production, and regulation occurs in the hypothalamus-pituitary axis. These two glands, located in the brain, are responsible for a wide variety of hormone regulation that includes thyroid function, reproductive hormones such as estrogen and testosterone, adrenaline, dopamine, and others, in addition to growth hormone. The regulatory process is quite complicated and has an entire medical specialty dedicated to it, known as endocrinology. So I won't dive any deeper into that discussion, but I would encourage you to look it up if you want to know more. Now, growth hormone is an anabolic hormone. In other words, it promotes growth. And while this does include skeletal muscle, it definitely is not limited to that. It's also worth noting that it is not androgenic, as opposed to, say, testosterone, meaning it doesn't promote male sex characteristics such as facial hair and a deeper voice. Now, the most prominent effect of this hormone is that it promotes bone growth and is the primary hormone responsible for growing to an adult size. In children, it's largely responsible for determining height, and it is modulated by several complex mechanisms. Secretion peaks during puberty, where the most bone growth occurs, and then declines with age, like most hormones. Along with bone growth, it does promote bone mineralization and calcium retention. And then other functions include skeletal muscle protein synthesis, specifically sarcomere hypertrophy, increase in lean body mass, fat breakdown, protein synthesis elsewhere, not just in the muscle, decreased cellular uptake of glucose, increased glucose synthesis, release of insulin-like growth factor 1, which I will discuss in a separate video, growth of other organs, pancreas regulation, immune system stimulation, and promoting some level of thyroid activity. There is such a thing as the body producing too much growth hormone naturally, not from supplementation, and this can lead to one of two diseases. In children who secrete too much growth hormone, often from a pituitary tumor, you get the disease giantism. Think Andre the Giant. This person is excessively tall, often over 7 feet, and this occurs primarily because their growth plates have not yet fused. Now, if you develop this problem with too much growth hormone as an adult, you get something called acromegaly. The difference is your growth plates are now fused, so you will not be excessively tall. Instead, you have a constellation of symptoms which includes a prominent jaw, large hands, deep voice, and a bunch of other symptoms. There's also a spectrum of disease that can affect the hypothalamic pituitary axis, which regulates growth hormone secretion, leading to a deficiency. And this deficiency can occur as a child or as an adult, often secondary to something like a stroke or a cancer. And there's an FDA-approved growth hormone therapy available for these patients. And so I want to talk about growth hormone supplementation and athletic performance. Before I discuss the topic, I just want to make clear that this is an off-label use. It's illegal, and I'm certainly not advocating for it. I'm just sort of presenting the information that is available. There's limited and mixed evidence that supplementing growth hormone will improve athletic performance. It appears that growth hormone does have an anabolic advantage at the molecular level, but it is not clear that this helps with strength, power, or performance. So one double-blinded study found no increase on power output or oxygen consumption. Another study did show an increase in insulin-like growth factor 1, but again with no corresponding improvement in strength or performance. And a third study found that supplementation improved skeletal muscle synthesis no better than a placebo. One possible benefit is the buildup of connective tissue, speeding recovery from injury without any subsequent change in muscle mass or strength. Again, this is theoretical and not evidence-based, but it is widely held to be true in the sports world. And what are the side effects from supplementing or from having excessive natural production? This can include joint pain and joint inflammation, an enlarged heart, muscle weakness, ironically, high cholesterol, impaired glucose regulation, and an increased risk of type 1 diabetes, impotence, increased fatigue, and possibly an increased cancer risk. And because your body regulates the hormone using a negative feedback loop, long-term supplementation can actually wreak havoc on your body's ability to naturally produce growth hormone. In other words, you could stop producing it altogether, and this is similar to what happens with long-term testosterone supplementation. So the question is, should you supplement? And if you haven't figured it out by now, the answer is very simply put, no. It's illegal, in the US at least, and supplementation should only be done under the supervision of a physician. The more thoughtful answer is that there is limited and mixed data that it even helps at all. There are no slam dunk studies stating that growth hormone will boost your athletic performance. Rather, the dogma in the sports world exists primarily because of what we know it does naturally and how much supplementation helps out folks who have a growth hormone deficiency. Furthermore, there are many profound side effects, including and up to hindering the ability of your body to naturally produce the hormone at all. There are a few ways for you to naturally promote secretion. Primarily, this includes exercise, which is well known to allow levels to rise unchecked immediately after exercise. This is certainly true of resistance training. And in endurance training, some studies are actually a little mixed and found long-term training can reduce growth hormone. Healthy sleep is the other primary booster. Those are the two that you should focus on. Other promoters of growth hormone secretion include stress, starvation, puberty, as we discussed, low blood sugar, and other hormones such as growth hormone releasing hormone. And so in conclusion, there are many important functions, especially for bone growth during puberty and adolescence. There are diseases where your body produces too much or not enough. There is limited and very weak evidence that growth hormone boosts athletic performance at all, and it has many known side effects, so you are not advised to supplement given this information. There are natural ways to promote it, and that primarily includes exercise and sleep.
Congenital genetic abnormality or brain structure. Tumor of the pituitary gland or the hypothalamus and metastatic disease. Surgery or radiation therapy of the pituitary or hypothalamus. Infiltrate disease, sarcoides or tuberculosis. Infarction of the pituitary or hypothalamus. Head trauma. Pros and cons. Metabolic problems such as increased body fat, altered lipid proliferated in the blood, decreased exercise capacity, bone mineral deficiency and insulin sensitive, transcriptor factor defects, GA receptor or post-receptor defects, GA releasing hormone receptor gene defense. GA gene defects.
Growth hormone deficiency AGHD. In adult growth hormone deficiency, there is reduced lean body mass, increased waist to hip ratio, and increased fat that leads to hyperlipidemia and hypertension. The system most affected by adult GH deficiency is the cardiovascular system. There is left ventricular dysfunction and a threefold increase in cardiovascular mortality. On the bone, there is reduced bone mineral content and increased fracture. There is hyperfibrinogenemia. 25% of the patients have low normal IGF-1. The psychiatric features in adult GH deficiency are anxiety, depression, loss of memory, and lack of concentration. So how the adult GH deficiency is diagnosed? The test to diagnose adult GH deficiency is insulin-induced hypoglycemia. When blood glucose goes down to 60 mg per 100 ml 1 hour after the peak GH level occurs and remains so for 2 hours. In 90% of normal individuals, the GH is more than 5 microgram per liter. A GH level of less than 3 microgram per liter indicates GH deficiency or AGHD. So what are the contraindications to insulin-induced hypoglycemic stress test? Contraindications are diabetes, ischemic heart disease, cerebrovascular disease, epilepsy, and elderly patients. The other tests done are L-arginine test, GHRH test, and GHRP test. Growth hormone, release hormone, and growth hormone receptor proteins.
Used a plate in Ecuador to offer a correct and timely diagnosis to children with growth hormone deficiency. The Los Ceibos General Hospital has created the first clinic of lot size of the Ecuadorian Institute of the Social Security, made up of general practitioners, pediatrics, neonatologists, and pediatric endocrinologists.
The main sign of growth hormone deficiency is poor growth. Not just that a child is short, but it's that they're not growing well. That's why it's very important to have routine physicals with your pediatrician, because that is where your child's growth will be monitored on their growth curve. As long as his or her height is steady along their growth percentile, then there's no concern for growth hormone deficiency. But if their height falls below the growth curve, that's when the pediatrician will alert you to a possible growth hormone deficiency and will start an evaluation.
In conclusion, a rigorous biochemical diagnosis of adult growth hormone deficiency is required to diagnostic pathology attenuate growth hormone levels from diminished levels due to normal again. Growth hormone represent might be beneficial for persons while proven adult growth hormone deficiency. About a randomized control trials and the need to refine individualized efficacy emerges determining serious benefits. Thank you.
Does your child seem much shorter or much taller than other kids his or her age? It could be normal. Some children may be small for their age but still be developing normally. Some children are short or tall because their parents are. But some children have growth disorders. Growth disorders are problems that prevent children from developing normal height, weight, sexual maturity, or other features. Very slow or very fast growth can sometimes signal a gland problem or disease. The pituitary gland makes growth hormone, which stimulates the growth of bone and other tissues. Children who have too little of it may be very short. Treatment with growth hormone can stimulate growth. People can also have too much growth hormone. Usually the cause is a pituitary gland tumor, which is not cancer. Too much growth hormone can cause gigantism in children, where their bones and their body grow too much. In adults, it can cause acromegaly, which makes the hands, feet and face larger than normal. Possible treatments include surgery to remove the tumor, medicines, and radiation therapy.